So today we're going to talk about an extraordinarily important paper, very important paper. It reads, and I'll explain in layman's terms, anytime I read from the paper, I'll explain what it means. Demonstration of central conduction time and neuroplastic changes after cervical lordosis rehabilitation in asymptomatic subjects, a randomized placebo-controlled trial. This was put out in Scientific Reports, which is a very high impact journal, very important journal. It's part of Nature's journal consortium. It's 2021 paper. It's new, it's relevant, and it's really important. So let's dive into it. First of all, what did they do? They took two groups of asymptomatic. That means patients that didn't have any symptoms, no pain, all right? These people felt good. First, they made sure they all had similar characteristics, which what they were looking for in this paper was loss of cervical curve and forward head posture. So they lost the C-shaped curve you're supposed to have in the neck. It was straightened out, and they had forward head posture, all right? That's important. In one group, the quote sham group, they did some stretches, some manual muscle therapy. They did some general like PT rehab type stuff. All right. To the other group, they did those exact same procedures and implemented some CBP, chiropracticbiophysics techniques and a type of traction to try to restore cervical curve and reduce forward head posture. All right. So that was the differences between the two groups. Here's what they found. It's crazy. First of all, before treatment, they found that in all subjects from both groups, they had a decreased in central conduction time. What does that mean? It means the amount of time it took for nerve signals to get from the patient's body to their brain was slower in patients that had forward head posture and lack of curve. That means that if you don't have proper posture or spinal alignment, that your nervous system is slowed down, that your brain is not becoming aware of what's happening in your body as it should be. It's taking way too long for your brain to know what's happening when you're moving your arms or moving your legs and looking and your body moves. That's not good. It's not good. You want your brain to know what's happening in your body and you want it to know quickly. And if you don't have proper spinal alignment, you don't. They found that the more forward you were, the slower the conduction time was. The other thing they found was that there were neuroplastic changes. What does neuroplastic changes mean? It means your brain changes for the worse. It was trying to compensate for the lack of proper nerve flow coming from the body to it. So your brain actually changes. It's neuroplasticity for the worse in compensation when you don't have proper input going into it. Not good. You don't want your brain changing. You don't want it changing for the worse. You want to improve your brain. You don't want it to get worse because you've got bad posture or bad spinal alignment. So then they put all of these subjects through the trial, through the sham treatment or the CBP chiropractic treatment, and here's what they found. The sham treatment, who just got like muscle work and mobilization, they had no change or improvement to their forward head posture or to their curve. That means traditional chiropractic and rehab techniques don't restore your curve or reduce your anterior head carriage. They also found that those patients who got the quote sham treatment didn't have any improvement in their central conduction time. So their nerve flow didn't get any better either. What they found in the group that got CBP was that they got improvement, significant improvement in both their anterior head carriage and cervical lordosis, which then led to an improvement in central conduction time. So when you improve your posture, you improve your nerve flow and your brain starts to know what's happening in the body again. These aren't people with pain. These were asymptomatic patients who felt good. They still had these nervous system deficits before correction, and they got improvement with correction. It's important that your spine's in proper alignment.